It's really important to us that we, really focus on equity and trying to make sure we're filling all the gaps, we're identifying all the barriers and trying to find ways to alleviate those barriers for the Oklahomans that we work with.
Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a special guest today doing some really important work that I think can honestly have a lot of impact when we apply the insights to some of our organizations at the health system level. Keely White, can you please introduce yourself and your current role?
Sure, yeah. Hi, I'm Keely White. I'm the Director of Community Health Programs at the Regional Food Bank of Oklahoma. We serve 53 counties of central and western Oklahoma, and I actually oversee all of our health and nutrition programs, including our partnerships with hospitals, clinics, federally qualified health centers, as well as our older adult focused programs.
We really appreciate you coming on. I know we don't usually bring on individuals who are in that kind of nutrition space, but with food as medicine getting more popular, and also I've seen a lot of impacts of it with our members. I really wanted to bring someone on who is really transforming in the space. You were a dietitian by training in undergrad, right? In 2012, you got your degree in dietetics and in clinical nutrition. 10 years later, you got your MPH. What got you into that space to begin with? Why did you want to go into this nutrition, dietitian, food area?
Yeah, that's a great question. So, I actually had a childhood cancer growing up for about 7 years, and um, really kind of learned the not only the importance of just maintaining a healthy diet while trying to go through, everything you have to deal with treatment and surgeries and things like that. But it was certainly a financial strain on my parents and our household. And so really kind of getting a small glimpse in that experience in how expensive eating
Mm.
healthy food is and how difficult it is to maintain just a healthy diet and lifestyle in general, but especially when you're going through a health crisis, especially a chronic health crisis lasting multiple years. So that kind of got me interested in the nutrition space. And then I did a lot of work, nonprofit work, kind of in food assistance globally, overseas in Haiti and Rwanda, Tanzania. And really, that really kind of opened my eyes to public health. And now working kind of in the food insecurity space here in Oklahoma, I had been really wanting to get my master's in public health just to make me even better at my job. And in 2020, I thought, well, I'm not doing anything else. So, other than working, so might as well go ahead and do that.
And how did that change things for you in terms of your career trajectory and the work that you do?
Oh, I mean, having a public health lens is so helpful. It really helps me have a better understanding of the root causes of food insecurity, of um, everything that really needs to be considered when designing and building programs, and just making sure that the the people that we're working to serve are considered and are a part of building that program, and they have a voice. And um, it's certainly helped me to raise the impact of the work that at least I'm involved in here.
Because you started as a mobile pantry coordinator, and then for 10 years you've been with Regional Food Bank of Oklahoma, and you've moved up, right? Every it looks like every 2 years, 1 year here, about a year there, all the way up to where you are now as the director of community health programs, and that's an important role. And so it makes sense how you've had this blend of that. public health perspective that I think is really important. What are the biggest challenges that you've seen through your 10 years in the community in Oklahoma? I'm from the Northeast. I'm not as familiar with Oklahoma, so I'd love to hear more about it.
Yeah, definitely. Yeah, it's been a really, really great experience. I've had the opportunity to work directly with um, individuals and families that we serve every day, and kind of also work directly with a range of different age groups and individuals with different sets of barriers. But I would say probably one of the biggest hurdles that we have to constantly try and find resolutions to is Oklahoma is a very rural state. And we, as a food bank, cover one of the largest um, service areas of food banks across the nation. We cover 53 counties of central and western Oklahoma. And so it's really important to us that we, really focus on equity and trying to make sure we're filling all the gaps. We're identifying all the barriers and trying to find ways to alleviate those barriers for the Oklahomans that we work with. Um, trying to find partners that can start a food pantry or be some kind of a program partner in rural, small towns that have very limited resources can be really challenging. There's some incredible partners that we have. We couldn't do our work without them, and some of them honestly amaze me at how resourceful they can be, even in small towns that don't have a lot of resources, whether it's financial, whether it's roads, whether it's volunteer resources. I mean, there's kind of a wide range of things that it takes to run a food pantry in a rural town. So
Yeah.
I would say that's probably one of the biggest hurdles we have.
So in the urban areas, we deal with issues. We deal with crime. I think is a big one, or just general safety of some of our members. They are afraid to use transit or go outside. But overall, there is a kind of a surplus of volunteer support a lot of times, and then there, of course, is usually some infrastructure to help get people around. In the rural areas, from what you're saying, sometimes you're just saying there are even road issues with people getting to and from. Um, how do you fix issues like transportation, like people being able to get the food in these rural areas? I mean, I can
Mhm.
imagine if you can't afford a car or you're too elderly, where you're not able to drive, that must be a real barrier for some people.
For sure. You know, that's a really good question, and it's something we're constantly having to figure out because not every community is the same.
Yeah.
So some you may be able to identify some public transit organizations that you're able to partner with to help people, especially who are unable to access transportation, whether they can't drive or um, they live very far away from a bus stop. And then there are some communities that don't have that. So there's all kinds of different ways to try and alleviate that. I know even with our summer feeding program, we're looking at, okay, how can we do door to door delivery?
Mm,
And then with our senior program, we work really closely with the local public transit Embark to provide food deliveries with them. And we actually are working really closely with the state on an incoming transportation project specifically for older adults to essentially support organizations that are providing that assistance financially, since that's also a big part of the issue is having sustainable funding to do these things. And hopefully this project will enable more access to transportation for seniors who need to get to a food pantry or need food from a food pantry delivered to them, but also to other things that are important, like going to the doctor, going to a grocery store, um, you know, going to a DHS office or anything like that. So It's what makes it challenging is every community is different,
Mm.
and so you have to kind of find a solution for that specific community, but that's
And
also super important in general.
how do you do that? And I think that that is really important, right? Because you can't, assuming if you're in northern or eastern Ohio, it's a bit different on the completely other end of the, or Oklahoma rather, it's
Yeah.
different. And you're in Oklahoma City, of course, where you're based out of, right? So, but you
Mhm.
cover a lot more than just Oklahoma City. How
Yeah.
do you figure out what works in the community? Do you go there in person? Do you have contacts? What does that look like?
Yeah, we actually have a team in our department called Community Connections Managers. And so they do a lot of grassroots work within communities. They're spread out by kind of their own service area. And so they really get to know our partners in those areas. They get to know the community resources that each of those partners has. They do a lot of grassroots efforts to create new, especially food pantry partners in areas that don't have one. So they do a lot of that work and really get to know the community's needs, kind of what the barriers are and what the gaps are. And so that's really where we start. And then generally trying to work directly with the community to figure out, okay, what's the best solution. So we're really lucky to have that team. They do an incredible job and really help us kind of hone in on that community and not try and come in and solve all their problems, but come in and try and support.
Yeah, that's so essential. I really appreciate that too. Come in and support and not.
Right.
It's like that. Trying to fix things from within instead of steamrolling everyone from the
Right,
outside. Yeah.
exactly. Yeah, yeah, we definitely don't wanna do that, and we like to say once you go to one food pantry, you've been to one food pantry,
Yeah.
they're all very different. They all, are very much a part of their own community and have their own culture, and, you it's we never wanna go in and say, "It's our way or the highway," or, "We think you should do this."
Right. No, absolutely. What are some of the best wins or the things that you've done in the role that you're really the most proud of?
So in my area, I'm mostly in the health, nutrition, and senior space. So it's a good question. Honestly, probably our healthcare partnership program is a really big win. It's something that we piloted for a few years and then officially launched a model in about 2016, 2017 with one clinic and developed that model with the clinic and began to kind of expand. Um, it was a little bit challenging to expand the first few years to really get people to understand that food insecurity was a major issue and that it did affect the patients of these clinics that we were talking
Mhm.
to. And then, COVID was horrible, but the silver lining is it really highlighted the issue of food insecurity and health at the same time. And so interest really kind of skyrocketed, and we went from four healthcare partners in 2019 to now we have 57
Wow.
across central and western Oklahoma. So that includes major hospitals, clinics, includes critical access hospitals in rural areas, federally qualified health centers, free clinics, and even some mobile clinics. So we're really proud of that, and we work really closely with some great partners like the Oklahoma Hospital Association, Oklahoma Primary Care Association, and the Oklahoma State Department of Health.
What's the first step you take when you get involved in one of these partnerships? Because that, I mean, that's an incredible rate of growth, of course, which is
Yeah.
excellent. But that seems challenging. It doesn't seem like it's the easiest thing to do.
Yeah, it's been a crazy few years for sure. I mean, we've really learned a lot through the chaos and have developed a really really kind of seamless onboarding process. So we just meet with the leadership and hopefully the individuals or staff at the clinic who will be involved in the program and give an overview of the program, answer any questions. And then once, they agree to be a partner, we work with them to implement food insecurity screening into their EMR. And so that way they're screening for food insecurity, able to identify kind of what the need is. And then from there, we train their staff on food insecurity in Oklahoma, on how it'll affect their patients, on how to kind of have that conversation with their patients since it is a very delicate. So they start to kind of identify what the need is. We help them understand how to have that conversation. And I think a lot of hesitancy that we saw previously was, you know, they hesitate to have that conversation if a provider doesn't know how to help. And so a big thing that's important for us is we tell them exactly what resources are available, how to help. And then from there, we actually implement a food pantry within the clinic setting so that when a patient is identified as at risk of food insecurity, they are provided with immediate access to healthy food assistance and then also are referred to a local food pantry in their area. They're also referred to SNAP application assistance and other federal program assistance, and just really trying to get them not only immediate access, but sustainable access to these resources. And hopefully, also, we encourage the providers to have a conversation about how important it is to maintain a healthy lifestyle and a healthy diet. Um, because once, if you're eating unhealthy and you're already food insecure, developing a diet related disease can really make it even more difficult to escape. So, so yeah, we really encourage that and then go from there.
Yeah, no, that's awesome. That's really, really important too. I agree with what you're saying, right? It's, if doctors say, and we've discussed this before too, one on one, if doctors have to say, are you struggling with affording food or getting food? And they
Hmm.
say yes. And then the doctor says, oh, I'm so sorry, moves on. Both people come away
Right.
feeling really negative. The doctor feels really bad because he kind of, he's been, he spoke with Houston Methodist about this. It was same exact kind of conversation. And they said, the doctor goes through 12 years of education. They come into the room and they can't help with something. It makes them feel really negative. And so then,
Yeah.
of course, the patient feels negative. So I like this a lot. One of the big questions though is, how does the funding work? And you don't have to go into details, but is it a partnership with the hospital or with the system, or is this provided for free? What does that look like?
Hmm. So it just depends on the partnership. Some of our healthcare partners do have their own foundation that they're able to fund the program to. But then a lot of our partners don't, federally qualified health centers, especially free clinics, critical access hospitals are already struggling. And so we actually do a lot of our own fundraising for this program and aim to always offer it at no cost to our partners.
Wow.
So that certainly is helpful in bringing in new partners since it doesn't strain their budget. And, we're able to get some or work directly with some fantastic local foundations like the Integris Foundation to provide provide this program to, especially a lot of their providers. So we have a lot of great partners that help us fund the program, and then we do our own fundraising to offer it.
That must be very fiscally conservative, though, or it must be a kind of a tight environment, right? Because I know a lot of programs, when you get funding from the federal government or when you have like a sustained amount of funding, it makes things a lot easier.
Hmm.
But this is definitely more of a cost constrained thing. How have you gotten good at fiscal management? Is that a skill that you've had to learn?
In nonprofit, definitely. Yeah, I'm juggling many grants, both federal grants, state grants, foundation grants. So I'm just trying to bring in as many grants as I can to take some of the pressure off our organization to financially fund this program. And so, definitely have had to get really good at that and build those skills sometimes through, learning the hard way,
Yeah.
unfortunately. Luckily, I've had 10 years to learn the hard way
Yeah.
here, um, but yeah, that can be very challenging for sure.
Yeah. Any advice for whether it's experienced leaders or even early careerists? You think to yourself, back when you were just starting your MPH,
Mhm.
yeah, I guess you weren't really an early careerist. You already had quite a bit of experience at that point. But any advice on, people look in the community and they say, I really want to help, but I don't know how to
Mhm.
get started. We don't know how to get these partnerships going. Any advice?
Yeah, I mean, obviously, do some landscape research what programs are already out there. It's so much better to not reinvent the wheel if you can avoid that at any cost. So doing everything you can to kind of figure out, okay, what models are out there, what models have been working, and then talking to the people who are managing those programs. And really getting an idea on what barriers they have, kind of going through the whole SWOT process of strengths and weaknesses of your own organization, and then looking at, opportunities and threats and what would work. But then also taking that and going to your prospective partners and asking them what would work. So honestly, I think the best thing we could have done was we did a 2-year pilot to start with to really kind of figure that out. And, obviously it's a pilot, so it's chaos and a mess, and you have no idea what you're doing at
Yeah.
all. And then from there, just building that model with your clinical partner. So I would say do all that, but then also keep in mind you're going to make mistakes. But I think it's important to have a perspective of, okay, we're learning,
Yeah.
and kind of knowing going into it that almost nothing will work out how you plan it to. Um, you know, Things are so much different now than what I kind of had kind of pictured originally. Just different parts of the model that we use. But it's so important to just be as flexible as you can and learn from your partners.
Yeah, really important advice. So don't go in blind. Do as much
Yeah.
research as you can. Try not to reinvent the wheel, but
Yeah.
also realize you're going to make mistakes. It sounds like you've learned this from a lot of experience.
Uh-huh. Yeah. Yeah. Definitely. And, constantly trying to remind myself, especially when you're in the pilot process, that the most important thing to do is to learn.
Oh, yeah.
So, and just reminding, your team or your partners or people around you that it's not going to go perfect. Um, Bear with me, as much as you can.
I don't like it when things don't go perfect.
Me
It's
neither.
hard.
Me neither.
Yeah, that's really tough. It's impressive work that you're doing, though. I really appreciate you spending
Thanks.
this time today during your lunch, or I think you're a little bit. You're an hour behind us. I think you're in Eastern, right? So,
Yeah. Yeah. Of course.
yeah, I appreciate it, and we'll be staying in touch. Of course, we really hope that we can bring you on again. As I mentioned, I
Yeah.
was actually talking about similar things. How do we start implementing in clinic food pantries and things like that? It's so important. So I really appreciate you coming on.
Yeah. Thanks so much for having me, and always happy to share anything we can do to expand the impact as far as we can. That's the whole idea.